Hello, my name is Elson, and for my clinical nursing and EBP assignment, I interviewed Karen Ganaway, a UC graduate and nurse for 8 years. Karen is currently employed by UC Westchester Hospital and a big proponent for the use of evidence-based practice. She remembers taking scientific basis for professional nursing practice and learning all the ins and outs of the EBP process and model while getting her undergraduate. I asked her to describe the term evidence-based practice in her own words, and she explained evidence-based practice has 3 parts. It combines research, clinical experience, and patient preferences. So instead of doing what's best shown in the research to direct your treatment methodologies or what patients want, or just what you've seen in your own experience, it combines all 3 of those into one final decision. I also questioned how evidence played a part in her daily life as a nurse. She informed me she often uses the JNC 8 guidelines for treating a patient who newly presents with high blood pressure, expressing me that the extensive research that went into writing these guidelines, including specific populations such as African American versus Caucasian, elderly versus young populations, and diabetic versus non-diabetic, it has become her go-to for which interventions to employ right out of the gate. One example of an evidence-based project that her unit worked on was the medical home concept, which involves being the point of contact for patients with any type of questions, any type of problems that they're having, and looking at the whole person, not just one specific complaint or disease state that he or she is managing. If they have psychiatric issues or they need surgery of some type, or basically anything they want, the patient is asked to call her first instead of going to the emergency room or trying to get referrals. They implemented this idea with the hope to create a more comprehensive health history and give patients more overall confidence that their problems are being taken care of. This is part of an ongoing effort, but the results they have received so far have shown dramatic increases in comfort and satisfaction. On a closing note, I asked her to give me her opinion on how important it is for undergraduate nursing students to learn about evidence-based practice. She communicated to me that it's very important and that if you're going to be a nursing leader, you have to stay on top of it because it's what's going to drive the future as we move away from attitudes of doing things because that's what the doctor told us to do or that's what we've always done.